I think you want to come to a program where every time you wake up, you feel inspired to be where you are. I get to feel like I'm part of something that's larger than myself here, that organically strikes that chord for me.
If what makes you tick is heart surgery and taking care of people and making them feel that they're the only thing that matters in the world, Penn is really the best place for you.
Penn surgery is about excellence in clinical care and about putting the patient at the center of everything that we do.
A cardiac surgeon that finishes Penn has the tools to do pretty much any operation, not only now, but has the tools to adapt to what operations will be needed in the next 10, 20, 30 years.
We're surrounded by a lot of people who are motivated to define the future and to achieve excellence in all the forms that excellence can occur.
You would be hard-pressed to find any other academic set of surgical training programs that have produced as many academic leaders across the United States. It is a source of tremendous pride for the teaching faculty to train the next leaders in academic surgery.
When I looked at Penn, it had all of the things that you would want to see in your future cardiac surgeon. Strong operative experiences, and they had a strong teaching culture. They also had great mentorship for things like research projects that groom you to be a very good academic leader.
One of the most fulfilling parts of our training program is that from a point at which you're very junior in the residency program, people start giving you responsibility.
Our culture is to teach while we operate. You learn from doing. You will very quickly be on the right side of the table for almost every operation one can imagine.
They'll start letting you do little pieces of cases, and attendings will really take an interest in you, and they'll tell you, you know, you did that in an excellent way, or you could improve upon that by doing this. And the fact that somebody takes the time to walk you through that, especially in a field like cardiac surgery where time is very critical, it's going to motivate you to learn more and more every single day.
We seek residents that relish coming to work every day, that really enjoy operating and taking care of acute dissection at night, and they're up all night, or the transplant patient that they see that they have the opportunity to give a new heart to.
One word that best captures the common element among all of our trainees, it would be tenacity.
All of the junior residents in my specialty have gotten together for the last couple of years, designing ways of practicing at home, because almost always at the end of the day, you go home after an operation wishing that you could have done some aspect of that better.
Our strength is for people that want to partner with us in making you the best surgeon possible.
Penn Surgery is in the center of the University of Pennsylvania campus and really allows us within walking distance access to the best minds in the world, innovators, people who are pushing the boundaries.
Penn is internationally known for surgeons that can do things and will operate on people that no one else will take a chance on.
At any national conferences, you see attendings from our program speaking on some of the latest developments in any area across cardiac surgery. And those kinds of things have real implications for training, because it means that you're there for those conversations with industry leaders, with attendings who are devising clinical trials. As a trainee that gets to participate in the first time that someone's performed this procedure, I feel very lucky to have been in the room where it happened.
For a very large institution, it feels incredibly small, and there is a sense of community here.
Any of my junior residents can come to me at the end of a long, tough day and say, hey, can I talk to you about something that I did that I want to get off my chest? And I could do that with my peers and any of my senior residents. And the fact that surgical residents can learn to be vulnerable around each other is, I think, an incredible thing and a new cultural phenomenon that makes Penn Cardiac Surgery one of the most collaborative teaching and learning environments that you can find in this country right now. Philly, I think, offers everything. It gives you a chance to be a real human being while being a resident. You know, you can find aspects of the city that are very accessible, both by distance and financially. Therefore, I think people who are training here have a chance to live their lives outside of the hospital to the fullest extent afforded by the city.
When I told people that I wanted to go into cardiac surgery, the answer that I got from a lot of people, or the response, was, if you want to have a family, you should just kiss that idea goodbye. You know, I want any woman who's interested in cardiac surgery to know that that's not something you need to compromise on. 2 months ago, I gave birth to my son. His name is James. My program has been so flexible in terms of how I was able to meet my goals of having a family and still becoming an outstanding surgeon.
Taking you and helping you to find who you want to be, that's what drives us here at Penn Surgery.
Our true legacy will be our residency program for the graduates, for what they become, for the patients they take care of, and for the leadership they will provide to American cardiac surgery over the next many decades. This is what Penn is most renowned for, and this is our training program.